Hey there, welcome back. A cancer awareness event is headed to Augusta. It's the 1990s Prom Sneaker Ball charity. And joining me today is Elizabeth Brown to share more. It's great to see you.
Thank you. It's glad to be seen.
That sounds good. So it's going to be Saturday, September 22nd, 6 to 9 over at Julian Smith Casino.
Correct.
But before we talk about that, this is your 1-year cancer anniversary.
That is.
Yeah, okay. So tell me your story.
So for several years, about 13, 14 years, I had been suffering with fibroids, and they had been moderately progressing up until November 2022. They had grown. First it was 1, then it was 2, and then they were getting larger. And then I called my OB/GYN because my annual wasn't scheduled until May to try to get an earlier appointment. Prior to that, they hadn't been able to reschedule me. I was going back and forth to the urgent care and the ER. My blood pressure started rising, my anxiety was peaking, and finally I made it to the annual appointment in May, and they were scheduling for surgery. One of the loopholes that they stated was insurance required us to do a biopsy to approve the surgery. When the biopsy came back, actually it came back positive for cancer. And so changed the scope of things, had to change doctors, change hospitals, got scheduled to do surgery in July. And then they told me that they weren't sure how it had progressed without the pathology report until they actually went in and did surgery. After surgery, they had to go vertical because it had grown to the point of an 18-week pregnancy. So I couldn't do the robotic surgery, couldn't do horizontal cut. 34 vertical cuts, 34 staples later, found that I was a stage 3B. And so they suggested that I do chemo immediately. And so I went into scheduled for chemo about 6 weeks later, and then, yeah, that's where we are today.
Wow.
Yeah.
So do you think if you got a more timely diagnosis, it would have looked a little bit different for you?
It's possible. With certain demographics and cultures and atmosphere, cancer works differently, and it's more progressive and it moves faster. So would it not have occurred? Probably it would have. Would the surgery have been not as invasive? Absolutely. I think that had I got an appointment sooner in January, February, and the biopsy done, I would not have had those 34 staples in that vertical cut. Absolutely. But it's what it is.
Yeah, and you were telling me something about the gap in insurance. You said that's a problem that we're dealing with here in Georgia.
Right. So I had primary care coverage from my job. The contract ended May 31st, and they didn't renew the grant that covered my salary. So they offered me my PTO time that I had, and then 3 months of health care, which would have covered the initial surgery. But when I learned that I had to do chemotherapy, I knew August 31st the coverage was going to end. So on September the 1st or 2nd, I called to get new coverage, and Cobra was going to be like $2,600.
Yeah.
The insurance that I had ended, and chemo was going to start August the 31st when my coverage ended. And the insurance company said they could start my coverage on October the 1st, which gave me a 30-day gap. So I learned then that there is a coverage gap in the state of Georgia, and that because I wasn't 62, because I didn't have minor children, and I wasn't legally disabled, I could not get the Georgia Medicaid coverage that they had. I also learned that they have women's health coverage, but it doesn't cover endometrial cancer. It only covers breast cancer and cervical cancer. So any other parts of GYN is not covered under that. So I was without insurance. I had to call family and friends to help with financials. I went into my savings account and I applied for different in-house programs at the Georgia Cancer Center to help me pay for my treatments and my pharmacy as well, my prescriptions. So that's why we started planning. I thought, no one shouldn't have to go through this trying to figure out how they're going to pay for it, what they're going to do if they cut the lights off or put you out and you're trying to heal and you need space for a bed rest. And then I thought, when I get through this, because at this point I didn't know if it was going to work, because 80+% of the coverage that they had at that time in research was on Caucasian women, and then the strand of cancer that I had, only 20% of the people had gotten it, and primarily African American women, we were suffering. So it was a real gamble at that time. But I said, when I get through this, I'm going to do something to help with awareness and with resources for persons that are affected by endometrial cancer.
And it seems like you're trying to fill in the gap with this event that's going to be on the 22nd.
Absolutely.
So tell me about who's coming. I see you got that list right
there.
Yeah,
I got my list. Chemo brain is real. I tell people that. I used to do this very impromptu, but I did not want to be remiss. And first of all, I'm so thankful to those that have already purchased tickets and made donations to be a part of this event, because in addition to the healthcare, the everyday living and resources are needed. Our premier sponsor is EST 1441 LLC. My daughter and I started this company when I published my first book, and the revenues that we've generated for that, we poured it into sponsoring this event. Lizzie's Hope Nonprofit and Angelic Community Resource Development, they are the host nonprofit that's helping with resources to bring it together. Jay's Place Barbershop and Barbershop Talk Live. If you cannot if you can't do it online, you can go to 1927 Olive Road to Jay's Place Barbershop. And our DJ and production, Angel Audio, they're going to be there to do the sound and DJing. Last but not least, Radical Catering, Crystal and Paul Brown. They have a wonderful catering business, beautiful spread, and awesome food. So all of those things will be inclusive, and we still have space for vendors and for sponsorships and for those that want to come. If you can't come, if you click on that tickets link on Eventbrite, you can also make a donation so that someone else can come, or you can sponsor a survivor. I'm going to support group meeting on Monday, and those that have made donations for tickets, we're going to honor it with survivors of cancer.
Oh, okay. Well, one more question. We're running low on time.
Okay.
How much are the tickets?
Tickets start at $50, and they expand if you want VIP seating, if you want to do a corporate sponsorship. You can go to Eventbrite, click on the link. If you can't make it, but you would like to make a donation, you can click on that link, go to donations, and add any amount, $5, $5,000. We'd be most gracious and appreciative for the contribution.
All right, sounds good to me. Let me give you the date and time one more time. So it's going to be tomorrow, which is Sunday, September 22nd from 6 until 9 over at the Julian Smith Casino. Thank you for being here. I appreciate it.
Thank you for having me.
No problem. And congratulations.
Thank you.
No problem. And we'll be right back.